Good morning, everyone. Today, I want to speak to you not only as a professor of clinical biochemistry and microbiology, but as someone who understands the reality of being a student nurse, especially in public hospitals here in the Philippines. Many of you come to duty after hours of traffic. Some of you arrive already exhausted from academic requirements, family responsibilities, or previous shifts, and yet you still show up. That alone tells me something important about your capacity to lead. The imperative for change. Philippine public hospital context. In public hospitals, resources are limited, patient loads are heavy, and wards are often overcrowded. Value-based care is not just a global concept, it is a necessity in our healthcare system. When early nursing interventions reduce hospital stays by 7% and readmissions by 2%, this matters deeply in public hospitals where beds are always full. Staff are overstretched, supplies are rationed. In this setting, proactive nursing is not idealistic. It is practical survival medicine. Clinical reality, toxic patients, and early warning signs. Many of you care for what we often call toxic patients. Those with multiple comorbidities, unstable vitals, and delayed consultations. In these patients, deterioration is rarely dramatic at first. It may look like a slight increase in respiratory rate, a confused answer during assessment, a lab value that is borderline but trending worse. In microbiology and biochemistry, these are early signals of systemic stress. A proactive student nurse notices these patterns even before a doctor is called. Redums and duty, pressure, without protection. Let's talk honestly about return demonstrations and duty days. Many students perform redums while sleep-deprived, anxious, afraid of making mistakes. This environment often trains compliance rather than clinical thinking, but real nursing is not about perfection under pressure. It is about safe decision-making under uncertainty. If your hands shake during a redum, it does not mean you are incompetent. It means you care, and caring nurses learn faster. Traffic, fatigue, and cognitive load. Long commutes and early call times are not just inconveniences, they affect attention, reaction time, clinical judgment. Biochemically, fatigue alters cortisol levels, glucose regulation, and cognitive processing. This is why proactive nursing must include self-awareness. Recognizing when you are tired, overwhelmed, or mentally overloaded is not weakness. It is part of patient safety. Demotivating. Clinical instructors, a hidden risk. We must also acknowledge a difficult reality. Some clinical learning environments are not psychologically safe. When students are publicly humiliated, constantly threatened with failure, discouraged from asking questions, they stop speaking up, and silence in healthcare is dangerous. A student who is afraid to ask or clarify is more likely to miss early warning signs. Reframing the proactive mindset for students. Proactive nursing for student nurses does not mean doing everything alone. It means asking questions early, clarifying unclear orders, reporting subtle changes even if you feel unsure. Proactivity is not about authority. It is about responsibility. And yes, sometimes it means speaking up even when your voice shakes. Simulation versus reality. Why simulation still matters? Some students say simulation is nothing like the real ward. That is true. And yet simulation teaches something critical: how to think when pressure is high, how to communicate when you are nervous, how to lead when no one feels confident. Simulation prepares your mind even if reality tests your endurance. Technology limitations in public hospitals. In many public hospitals, technology is limited. Monitoring devices may be shared, electronic records may be incomplete. This means your clinical observation becomes the technology, your eyes, your hands, your judgment. When resources are scarce, proactive nursing relies more heavily on human vigilance. Assessment, what should truly be valued. If assessment focuses only on mistakes, students learn fear. If assessment values risk recognition, communication, clinical reasoning, students learn responsibility. Patients do not need flawless students. They need students who notice, report, and care. Student well-being. Survival is not the goal. I want to say this very clearly. You are not here just to survive nursing school. Burnout during training leads to unsafe practice later. Mentorship, encouragement, and mental health support are not signs of weakness. They are investments in patient safety and workforce sustainability. The 5 step daily practice, adapted to real student life, even in busy, under resourced wards,